Hello guys, I'm Dr. Eric. Welcome to my YouTube channel. Today I'm going to take you on chest X-ray, and we have two views, posterior anterior, where the X-ray is taken from back to front. The light comes from back to front, and anterior posterior, the light comes from front to back. So we are going to look on our X-ray film. The left side of the patient should be on your right. So we are going to use a light box, which is going to help us on examination of X-ray film. So we are going to start. So for a good penetration of X-ray, if you can see the thoracic vertebrae, that one is a good light penetration. And if you see the poor penetration is when the lens is dark and the heart shadow is vague. That one is a poor light penetration. So on X-ray we start from outer to inner. So you start on soft tissues for any injury, trauma, or any pathology you can see on the soft tissues. So we are going to start on, there is a systematically way of viewing an X-ray. So you start from airway, A for airway, you check on the trachea and also the lungs. So you see on the lungs is a darker part because of X-ray. You see the air is black. So if you can see trachea when it is deviated, maybe the position of the patient and also the enlargement of thyroid gland can deviate the trachea. Tension pneumothorax can also deviate the trachea. You check on the bones. The bones are white, and also metal can be white on an X-ray. If it is not white with the uh, with the bubbles inside the bones, that one means that there's a pathology to the bones. Maybe arthritis, you can see, osteomyelitis, you can also see, and also you check on the ribs. Ribs, you can count the ribs for a well film. The posterior ribs should be 9 to 10. So you count, they slope. So you count 1, 2, 3, 4, 5, 6, 7, 8, 9. So this one is a good feeling. For the anterior, should be more than 7. So it runs horizontally. 1, 2, 3, 4, 5, 6, 7. So this one is a good film. Then you check on the C which is heart, circulation of the blood. So you talk of the heart. You see the heart. This side you can see the arc of aorta. You can see the heart. That supplies the blood. For D, you check on the diaphragm. So on the diaphragm, you can check, and also the lungs, you can check on the costophrenic angle. It's the angle between the lungs and the posterior ribs. This one is the angle. You check. If it is not there, there is a opacification. That one is a pathology. Then you check on the cardiophrenic angle, the angle between the heart and the lungs. Cardiophrenic angle. This one is a cardiophrenic angle. This one is a costophrenic angle. So the distance between the costophrenic angles and the distance between the costophrenic angles, if you find the ratio, you find if the patient has the cardiomegaly. So for a good film, if it is more than 50, you see there is a cardiomegaly. So you check also on the lungs if there is a pacification of the lungs. If there is pacification of the lungs, you think of pus, you think of water, you think of blood, you think of tissues. If there is tissue injury, you can see on an X-ray. and you check on the gastric bubbles, which is low at the diaphragm. If it is not there, you think that the patient has not fed. So this one is the stomach is somewhere here, the gastric bubbles, and you check also the compression of the vertebra. If it is not well, if the patient has the pathology on the disc, maybe disc prolapse, you can see on the on the X-ray, and check on the clavicular bone, the clavicular bone, the thoracic bones. You can see also in an X-ray. So if you are watching this video for the first time, please comment, like, and also subscribe. Thank you. See you in our next episode.